The third phase of the mass COVID vaccination drive in the country, which was supposed to kickstart on May 1st for the 18 years plus citizens, has been put on hold in many states of the country, including the 8 states in the Northeast owing to the shortage of supply of the vaccine. The 8 Northeastern states are still continuing with the process of vaccinating citizens above 45 years, and the vaccination for the 18 years plus would be delayed by at least 3 weeks. When we talk about the preparedness, the inability to roll out the May 1st vaccination drive has evoked criticisms from several quarters. While many people are all pumped up to get themselves vaccinated, others are still apprehensive of the veracity of the vaccine.
Government, they have failed to give us a proper information. There's many rumors going around. There's many fake news going around, people having a fake propaganda, and in fact the government should come out with the proper information, with the proper development, what they need to do for the vaccine.
I feel that the vaccines in India are not 100% safe and effective, since the reports and the statistics that I have seen have shown an increase in the amount of deaths and cases all over India ever since they started mass vaccination.
Yeah, I think government had taken very good decision. So we should cooperate and we should take vaccine.
ख्याल से तो वैक्सीन लेना चाहिए. हम लोग का भी घर में सब लोग ले रहे हैं, मतलब दादी लोग, पापा लोग, मतलब बहुत लोग आदमी तो यहाँ से मतलब डर रहे हैं कि कुछ हो जाए, कुछ मिला दिया हो या बीमार हो जाएगा तो कहीं पॉजिटिव ना निकल जाए.
Some people, they are scared and they make others also to feel scared about that. They create more rumors. Vaccine is not effective. Some they are died because of vaccine. Some they said that vaccine is not working like that.
They don't have to believe in rumors. Rumors can spread by idiot. I urge them that if they love the loved ones or the family, they should vaccinate it.
We should just listen to the healthcare department. What are the SOPs being provided by them? We just need to follow them. If it has to happen, it might be happening during the trial period, right? But I don't think so. They have many cases coming up during the trial period that people are suffering from infertility or something.
In Meghalaya, though vaccination for the 18 years plus category would be delayed, the registration for the same has already started. Chief Minister Conrad K. Sangma clarified that the vaccination will be rolled out as and when they receive the vaccine doses from the manufacturer, which in this case is the Serum Institute of India.
The effort is on to start the vaccination for the 18 plus. The registrations have started, but because of the shortage of supply throughout the country, that is, most states are not able to start on the 1st of May, the vaccination program. But that does not mean people need to panic. There will be a process, there will be a schedule. Once the registration takes place, we will figure out how we will schedule the appointments for vaccination based on the supply that is given to us.
Earlier, Principal Health Secretary of Meghalaya, Sampath Kumar, informed that the state has already placed an order for 30 lakhs doses for 15 lakh population of citizens between the age group of 18 to 44 years, and it would take at least 3 weeks for the vaccine to reach the state.
So we are getting a regular supply chain. So based on the speed with which we are actually vaccinating, if our vaccination, depending upon the uptake of the vaccination, Government of India also is continuously sending. In 4 weeks, we are expected to get a reply from this manufacturer, and then he will give a schedule for us. Based on the schedule, he will announce. The moment he says that, from May last week or June first week, whatever the date that they give, and we are expecting they will give a proper schedule every week. What is the supply? So according to the supply, we will schedule the vaccination.
Given the vulnerability of Shillong, Jowai and Tura to the virus, the government is looking at vaccinating urban lots first before moving out to the rural areas.
A lot of focus in these urban pockets where there is a lot of mobility. And so essentially, because here wherever there is a lot of mobility, there is a chance of more susceptibility in terms of contracting the virus. So we need to secure these people.
Tura, we have almost saturated the 45 age group. We have touched 90%, 95%. In Shillong, we have crossed 60%, maybe about 70% today of the 45 plus. Similarly, throughout the state also, we are almost close to touching about 45-50% of that. I don't have the exact numbers with me, but roughly in these figures. But we are seeing a great response, and we will ensure that the 45 plus are completed at the earliest.
There have been a lot of misconceptions about the vaccine and its after effects, rumors of which has created a sense of fear amongst the general public, and this in turn had resulted in the low percentage of vaccinated individuals in the state.
Now there is a lot of momentum has come. Initially we had a lot of hesitancy here. There was, you are aware, a lot of vaccine hesitancy because of, again, a lot of multiple misconceptions, and so now with a lot of effort and all, there is a slowly, in fact, especially the community leaders have stepped into people. That has helped. Now people are ready to take vaccines, like that's like now it's the time you prepared. Now we need to just wait for the vaccines. There's nothing. So till the vaccine comes, until everyone gets the vaccine, we should be very careful.
To throw some light on the importance of getting oneself vaccinated, let me break it down for you. Firstly, there are two vaccines available to the public. One is the Bharat Biotech's Covaxin, which is fully homegrown, and the Serum Institute Oxford University AstraZeneca's Covishield. Covaxin was developed by Bharat Biotech in collaboration with National Institute of Virology and the Indian Council of Medical Research. Covishield was developed by Oxford University in collaboration with AstraZeneca and manufactured by Pune-based Serum Institute of India.
See, both are Covishield and Covaxin, both are Indian made. In fact, both are made in India, and both have good efficacy. And in fact the data shows that they have efficacy, because if you see the data, a large number of data, those people who have taken this vaccine, how many of them are contacted with corona? If you look at it, in fact very few, very less percentage, maybe 0.4, 0.2%, like you see. So both the vaccines that way are found effective in terms of the protection. So there's nothing. The only thing is that we happened to actually receive Covishield by the government of India in the beginning, so we started using that. Yeah.
Now, what are the procedures to be followed once you get the first dose of the vaccine? Let me explain it to you. The dosage for both the vaccines is 2 and are administered 2 weeks apart. While for Covaxin, it is recommended that the 2 doses are given 4 to 6 weeks apart. The second dose for Covishield vaccination can be delayed up to 6 till 8 weeks. It was also reported that the second dose of Covishield can be administered up to 12 weeks after the first dose. The price range of these are different. While the Covaxin will cost the government Rs 400 per dose, the Covishield can be procured at Rs 300 per dose. But these vaccines are given to the public free of cost. In the Northeast, the state governments are procuring the Covishield from Serum Institute of India at the given price of Rs 300 per dose, and the amount would differ from state to state. In Meghalaya, the government is spending over Rs 90 crores for 30 lakh vaccine doses in the third phase.
We've already asked the company to supply us a vaccine. So as you said, it will cost us 90 plus GST. So therefore, though it will be a challenge for us, but it's a priority, and it's a, I should say, an investment or expenditure that is going to be beneficial for the people at large and state at large. The 45 plus injections and vaccination that have come have been given to us free by the government of India. So this is government of India's expenditure. They bought it at 150 rupees. But we are getting support. But obviously we are looking at other forms of support, like for example, if the price of the vaccine could go down, and the same rate at which the government of India is getting, if we can also get that, will be helpful. So these kind of supports we are searching for, and hopefully we'll get those supports.
There have been a lot of questions on the efficacy of these vaccines. Let me tell you that though these vaccines will not prevent you from contracting the virus, it would, however, lessen the severity.
It doesn't mean that you have got vaccination, you won't get infected. That's why I think some of us who have got vaccination may think that I won't get infection. No, you may still get the infections, but the severity of the disease will be less. Meaning is, you may get the infections, but hospitalization or admission in the hospital will be less.
If you ask me what will happen if everyone in Meghalaya or the entire country is vaccinated, I would say that it would create a herd immunity, which means if everyone is vaccinated, the virus wouldn't find a new body to infect and would naturally disappear.
Vaccination is a very important thing, especially to build that herd immunity. So as a state, we should aim to achieve the herd immunity as early as possible. The state is making all the efforts to get the vaccines and do it systematically. Suppose if somebody doesn't take the vaccination, then we will not achieve herd immunity. So basically we will be always vulnerable.
But before we get ahead of ourselves, let us remember that we are still in the midst of a great battle, a war to defeat this invisible enemy. And how does the government plans to do it? Well, the Meghalaya government is adopting a three-pronged strategy to beat the virus. What are those? They are: number one, mask containment, which means you are required to always wear a mask, preferably a medical 3-ply mask. Number two is vaccination, which means people are required to get themselves vaccinated to reduce the severity rate. And the third one is treatment, which means availing early treatment.
Everyone should start wearing a medical mask or a good mask, a 3-ply mask, and start wearing it properly. Second thing is that like vaccination. In fact, you should not have any hesitancy. If you have any concern, you should please speak out. We are here to explain to you. In fact, when we explain, people are taking vaccines. Third one is treatment. Treatment also we should learn about it. How actually it works. For example, we should know the symptoms. What are the symptoms? We should know when we have the symptoms what should be done. And in fact we should know, even like suppose if you have symptoms, immediately you should get tested.
For the mission to be successful, it is required for everyone to come on board in the theoretical sense of the word. The engagement of all stakeholders is pertinent to ensure that each and every citizen of the state and the country is vaccinated.
In any particular locality, the best thing is that we should create an awareness program at least 2 to 3 days prior to the vaccination. We have given wide publicity. We have appealed to all the Rang Vaishnavas. As community leaders, let us come forward. Let us get ourselves vaccinated. We need the leaders from different faith as well to come together with us in the same platform. So also from the government side, the health departments, it's a teamwork.
See, right now we are in the process of examination. We have hardly any chances to interact with the students because it is an offline examination. Once they carry on with the examination, then they go off. And we will be using this online website facilities and most probably the NSS and NCC to spread out what you call the awareness amongst the young youth of our college, the young students of our college, that they have to go for the vaccination once it is the thing is started. Because if they are safe, the country is safe.
Going forward, we can only hope that the vaccines reaches our state and region on time for its citizens to avail. And in the meantime, protect yourself by following the protocols of wearing a mask, washing your hands, and maintain social distancing. Stay home and stay safe. And don't forget to get yourself vaccinated. For more updates, make sure you subscribe to TNT The Northeast Today.